Dear friends, colleagues, honored experts, welcome to Precision Medicine Networking Forum 2025. Welcome to Riga. For the last 4 years, the Precision Medicine Forum has grown from just a bold idea to real engine of implementation. So when we created the Precision Medicine Forum, it was not just to talk about the precision medicine, but really to do it across the hospitals, labs, startups, ministries, payers, and the patient groups. So today and tomorrow, in fact, Riga once again becomes the European meeting point for the new science to meet the real patient needs. And you know, this forum works because of you, clinicians, scientists, bioinformaticians, also entrepreneurs, founders, policymakers, NGOs, and most importantly, the patient advocates. Thanks for turning up. Thanks for being ready to learn, to collaborate, and to act. So over the next 2 days, we will dive into various different subjects, which matters the most now. So how to bring the advanced diagnostics and data into routine pathways, how to accelerate oncology and also the pediatric precision care, how to make biobanks and clinical trials more accessible to the patients and scientists, how to scale artificial intelligence responsibly and interoperably, and how to finance and govern all of this fairly so that no patients and no family is left behind. But let's remember, it's not a conference, it's a networking forum first. So our success is not really measured by the number of slides you will see. It's measured by what starts here. So set yourself a goal, also probably before the next coffee break. For example, to meet 3 new partners. And by the evening, sketch 1 new joint idea. And before you make your way home, have the next step marked in your calendar, being it's a shared grant, the pilot in a clinic, or the data sharing agreement that shortens the road from the lab to the bedside. So whatever track you follow, being it oncology, pediatricians, biobanking, artificial intelligence, data, or microbiome, please keep our common mission in front of you, and that is to serve the patients. So that means better outcomes, faster answers, less toxicity, and more equitable access. Not in 5 years, but starting now. So here are Precision Medicine Networking Forum 25 commitments that I ask you to carry throughout the sessions, but also to take home. Firstly, connect across the disciplines and borders. Share protocols, share data, share all of the lessons learned. Promote clear evidence-based precision medicine pathways, but that clinicians can actually use. Support the evidence, support education and training, because skills, not the slogans, change the care for the patients. Show what works, share outcomes, highlight successes, but also the failures, so we can learn faster. Build awareness. So build awareness beyond our community. Make sure that the patients and the public are inside the loop. Collaborate with every stakeholder in the best interest of the patients. And finally, advance equity. Work so that breakthroughs reach every patient and every family in need. So none of this happens alone. It happens in conversations, after the talks, at the poster sessions, at the coffee breaks, in the side meetings that are arranged. So use them well. So before we begin, my sincere thanks to National Library of Latvia, to our supporters, to the sponsors, and to the organizing team that has worked, I should say, tirelessly, so that the 2 days ahead of us are productive and enjoyable. And thank you all for bringing your expertise, your ideas, and your energy to Riga. So let's make the most of it. But now, I'm pleased to welcome our honorable guests to offer their greetings and frame the work ahead for those 2 days. And I should say that almost none of topics in today's agenda can be separated from data and digitalization. So Latvia's health system is digitizing at speed, and our first speaker is at the center of that shift. She's driving interoperability, establishment of biobanks, trusted use of health data, artificial intelligence-enabled services so that innovation reaches patients faster. So please welcome Ms. Aiga Balode, Deputy State Secretary for Digitalization and Change Management in Ministry of Health of Republic of Latvia.
Good morning. Valts, actually, you touched my heart. And in Latvia, this week has been very emotional due to several things. You touched me because I think this forum only saw me how I entered in healthcare sector. I didn't know anything. I just had desire to help. But now back to minister's speech, because the important words to you all should be said by him today. He couldn't be here. So let us begin. It is, of course, a great honor for me to welcome you all here at the Precision Medicine Forum. And on the behalf of the Ministry of Health, I would like to thank you for your willingness to share the knowledge, for your zealousness to spread the knowledge, and for your very practical approach to connect science, healthcare, technology, and society. From the public perspective, precision medicine is more than a scientific concept. It's a promise that we all work together to make tailor-made healthcare a reality. It is a commitment to bring together data, as Walt mentioned, research, clinical practice, to improve prevention and treatment in ways that were unimaginable even a decade ago. It's also true that healthcare systems are facing dual imperative: the rapid integration of transformative digital technologies and the persistent challenges of managing chronic conditions alongside systemic healthcare inequities. For me personally, over these 4 years, this forum has been a learning platform about new treatment opportunities, about memorandums signed and cooperations launched, but above all, it has been a very vivid networking where everyone had been included, no matter which field represented and no matter which issues communicated. Therefore, I would like especially thank and emphasize both the invisible and the visible work done by the organizing team. In Latvia, we have made a significant progress. The national biobanking initiatives, genetic data infrastructure, and growing collaborations between universities, hospitals, patient organizations, and private sector partners. It has laid a strong foundation. We have established also Latvian Digital Health Center, a specific institution responsible for digital health governance. Yet, to maximize the potential of precision medicine, we must move forward with a clear focus. The Minister of Health, Mr. Hossam Sabumeri, has challenged us all today by saying, scale up and anchor mutual cooperation that builds trust, finds new ideas and ways to move forward. He's been even insisting on work together as one team with one common and shared goal, and that is to help our patients. Precision medicine should become our resilience bridge by connecting disciplines and generations, facilitating health literacy and thriving for public good, where prevention gains its importance. So let's work together, as Valts mentioned, get 3 new partners to work with, and let's turn scientific advancements into meaningful outcomes to our society. And once again, thank you all individually for your commitment. Thank you.
And now it's my pleasure to recognize, I should say, the driving force behind this forum. So our main initiator and contributor has matched his vision with action, ensuring that precision medicine network is not just a good idea, but a living network. His philanthropy has enabled the partnership for research and momentum behind today's forum. So over the past years, he has continued to champion pediatric oncology, but also the broader precision medicine agenda, supporting the work of many people that turns into promising concepts to support the patient care. On behalf of today's forum, John, thank you for your leadership, your faith in this community, and your constant push for the impact. So welcome, John Tully, on the stage.
Thank you so much, Valts, and thank you, the participants, scientists, researchers, doctors, people involved in precision medicine for being here and networking together, and that's what the event is about, getting people together to do more in this area. And I would say I have an announcement today that we have an MOU we will sign here just a little later that is about including AI resources. It will be between the Riga Technical University, the company that I'm head of at MikroTik, which has donated the funding for this equipment and this facility, or parts of it, and also the Children's University Hospital in Valts. The main point is that all of the works and the networking, I think the people that are here that are interested in participating, they've done an incredible job. We've seen a lot of great things come out of this event and the energy of the people involved. We can just mention one is Princess Maxima and Children's Hospital Cooperation, where they now have a 6-year agreement to work together on precision medicine mostly. So soon will be, I guess, Talis Juhna will be here explaining more about the facility and say the actual equipment. But one part, and I just talked to Talis earlier, I said, how can people in Latvia and interested in precision medicine say participate in this process, use this equipment? He said, well, the easiest way is you just call me. So I don't know it's going to be his telephone number exactly, but his office. So he'll be giving out the way to get involved in this. So we want everybody that has a need for these resources and wants to promote the goals of this conference to participate in the new technology and the AI resources, and there's a lot of work in there. Thank you. I wish you a great conference, to meet many new contacts and to get some new ideas and to push forward on this effort. Thanks.
Thank you, John. So our next speaker leads one of the Latvia's most important engines for innovation and talent. So he's a rector of Riga Technical University, where he champions stronger industry partnerships, real-world student projects, and much faster pathways from the lab to the market. He has led RTU to strengthen international ties, build the skills that employers like me in a hospital really needs: the data, engineering, and getting the things done. So welcome Professor Talis Juhna, the rector of the Riga Technical University.
Thank you for nice introduction and also for this, I think, great initiative which we starting today. Providing access to the infrastructure which is available at our High Performance Computer Center at Riga Technical University for all needs of the patients, for needs of the genetic data, which could be used to increase safety and our well-being. And I think the initiative which was started by John is something very unique, because what we offer is access to high-performance computing power, which is available now for all scientists, for all universities, to use this unique technique to run their research, to get more out of the data which is available and make our lives more safe. So I'd like to thank both John and all the partners for this, I think, unique experience. And on our side, we are very honored as a technical university to be part of this journey, because we realize that the future is in artificial intelligence, the future is in a big data, and we as a technical university are here to help you, both in terms of infrastructure and also in terms of the mentoring and all the necessary skills what you need to get the data right. So today we will sign this memorandum, and I think it's just the first step, because I'm sure that more and more data centers will open their facilities so they can be used, and we will learn more about how to use data and how this can create an impact. So thanks again, and I really looking forward to this agreement, to this memorandum of understanding. And again, I think this is a new beginning, not only for technical university, but for the academic science in general in Latvia. Thank you.
Yeah, thank you, Talis. Our next speaker leads the team that turns advancing computing into everyday capabilities for researchers and innovators. So Natalija Cernecka is director of Artificial Intelligence Center that coordinates the development of shared AI infrastructure, user support and training, so that universities, hospitals and companies move faster from the insights to the impact. So welcome.
I would like to thank everyone for inviting me to present the center and its interest at this stage. And obviously, the center is very young. I started my job several days ago, and I'm delighted that our first memorandum of understanding is in such an important field as precision medicine, as oncology, and other medical conditions. Obviously, artificial intelligence can do a lot in medicine, and we are delighted that we can collaborate together with John, whose company has been supporting research and development in Latvia, and obviously with Technical University and our long-standing partner, one of our founding members, and I would like to thank Talis Juhna inviting us to join this memorandum. The center, it's our mission, is exactly to build the bridges between public sector, private sector, education and research, to boost research and development, to boost applications of AI in Latvia so that we can advance all together. I will be quick. Thanks a lot. I'm looking forward to working together in this field. And as Talis said, this is just the beginning. Thank you.
Yeah, thank you. So as mentioned already, this forum is about the building stronger networks, partnerships, and also collaborations. So to highlight that, as mentioned before, so we are marking this session with a ceremonial signing of the new collaboration to create this AI data center for research, and specifically for biomedical research and also pediatric oncology. So with the support of Natalija and MikroTik and coordination of Riga Technical University and Artificial Intelligence Center, so this AI data center will be established. So the project will augment and accelerate the big data analytics, as you heard before, AI and simulation work, and many other opportunities. So crucially, these resources will be available to Latvia's research and also the clinical ecosystem, including the hospitals, universities, research institutions, but also the industry partners. So to formalize this step, I invite to the stage the Professor Talis Juhna, John Tully, the co-owner and benefactor of MikroTik, and Natalija Cernecka, Director of AI Center. So all set, pens on the table. So colleagues, please do sign the memorandum. Okay, time for a photo. Okay, thank you. Thank you so much. So congratulations to all of the partners, and we look forward seeing that these capabilities will put at work for the patients. Okay, and to continue, our next guest is a driver of Latvia's research capacity and also international reach. So, Vice-Rector of Science in Riga, Stradins University, she leads university's research strategy and cross-disciplinary collaboration. Under her guidance, RSU has strengthened research capacity, partnerships also with the hospitals and industry, and managed to attract the top investigators and focused really to turn the science into patient benefits. So Agrita, Kiopa, welcome on stage.
Yeah, thank you, Valts. Thank you, everyone, for being here. My name is Agrita Kiopa. I'm Vice-Rector for Research at Riga Stradins University. And I'm also moved and honored to be here and say a couple words. And I'm moved the same way as Aiga is because of Valts' words, but also of everything that many of you have already done since the first PMNET forum that we have started together a few years ago. And I think if we look back, we see what we have achieved, how many new partners we have met in this forum, how many research groups we have started. For instance, in Riga Stradins University, we have hired in 2 new research or tenure professors with their groups. One of them we share with the clinic, with the Children's Hospital, but also with the Heidelberg Cancer Center. Another we host within our own university. We also have refocused the work of our Institute of Oncology. We have started new collaborations and moved forward with bringing in our established collaborations. We will be signing several new agreements within the forum, and we will be moving forward also in showing ourselves and showing our work through our research information systems. And for me, it says that those little things that we actually do in our daily work that allows us to move forward with the principles of the precision medicine and implement those principles in a daily work, be it teaching, introducing to the students, be it focusing our research. This is what matters. And I think here we are a community of believers in those principles. And therefore, I think it's up to us to do the next steps. So I wish all of us the very fruitful networking, new connections, new friends, and I hope I meet at least, 1/3 of you in next events in Riga Stradins universities, and the remaining 2/3 probably somewhere in your institutions. So let us have 2 good days, and see you around in the forum. Thank you.
Okay, but before we continue, let's root our conversation in what really matters. And that's patients and measurable impact. So we're about to see the short video about the child with a spinal muscular atrophy who was identified through the newborn SMA screening and started his therapy in time. With his family's permission, we are sharing this reminder of why implementation and the speed really matter. So please turn your attention to the screen.
Viņa piedzima vesela, bez jebkādām tur tā kā, problēmām. Un mājās tikām arī laicīgi pēc tām 3 dienām. Pirmajā reizē mēs saņēmām zvanu no bērnu klīniskās slimnīcas, kad vai mēs negribam atbraukt vienkārši atkārtot to vizīti, vienkārši noņemt vēlreiz asins, jo asinsmaina pamainījusies. Mums tad jau neko neteica, ka kaut kas varētu būt tā kā nav, jo pa telefonu jau neteiks tev neko. Aizbraucām. Tur bija ļoti daudz ārstu, kas apskatījās viņu uzreiz, noņēma mums asins, mēs braucām mājās un nepagāja, man liekas, ka pat nedēļa, ka mums zvanīja, ka mums nekavējoties ir jāierodās slimnīcā, jau sāk ir ārstēšana. Stefānija pirmā Latvijā un pirmā Baltijā, kurai tik agrā vecumā ir uzsākta šī ārstēšana. Un viņa ir pirmā, kurai nav vispār neviena simptoma, nekas neparādās, ne kaut kāds regress, nekas. Arī bērnu klīniskajā viņai notiek vērtēšana, kā viņa kustās, ko viņa māk izdarīt, piecelties un visu pārējo. Un vienmēr viņai ir viss bijis pēc tam baļu sistēmā visaugstākais. Nav nekas tāds, ko viņa nevarētu izdarīt. Tas ir labi, kad viņai tik ātri, varbūt, jo es nezinu, kā būtu bijis, ja mums gada vecumā, pateikt, mēs varbūt nezinātu, kāpēc viņa staigā, un pēkšņi nestaigā, Tas ir labi, ka tagad tādas analīzes var uztaisīt, un zinu to, kad ir pēc Stefānijas vēl bērniņi ar šo diagnozi. Bērnu slimnīcā man nekad nav bijušas nekādas problēmas. Visi atsaucīgi un izpalīdzīgi un pretīm nākoši. Mēs vienmēr būsim ļoti pateicīgi bērnu slimnīcas daktariem un visam personālam par to, ka tik ātri tas viss notika. Un mēs jau tur tagad tā kā mājās aizbraucām. Mums tur, čau, Stefānija, jau pazīst Stefāniju, savu ārstējošo ārstu arī, dakteru Dīru, ka arī. Viņa zina, uz kurien brauc. Viņa vienmēr, kad mēs braucam, viņa jau ir sagatavojusies, jo iepriekšējā vakarā jau viņai pastāsta to. Un ka braucam, viņa jau saprot, ka pie ārstiem brauc un ka būs tā zālītes un vispārējais. Bet kāds 5. iedzīvotājs ir pārnēsātais šīs gēna, Un tā ir sakats, ka mums abiem ir kaut kāda vainošana, vai vai arī vīram būtu, es jau nevainotu viņu, un viņš nevainot mani. Sakats tā, ka abi mēs esam.
Yeah, thank you for that. So in fact, Latvia was among the early pioneers to introduce the SMA screening, and today our teams also have experience in applying the gene therapy for the SMA. And that really is a powerful example of how science, policy, clinical readiness can really change the lives of the child, and not only the child, the families. So I believe that's a strong reminder for ourselves to the difference we can make together through the joint efforts, advancing the therapies for the children that battle debilitating diseases. So, and now, as a cherry on a cake, we move to the keynote speech. Our keynote speaker has spent his career turning discovery into benefits for our patients. He's a professor of oncology in Gustave Roussy Comprehensive Cancer Center in France. He's a clinician scientist who helped to drive the cross-border precision oncology networks, early phase trials for children and adolescents, and the data sharing culture behind the molecular tumor boards. So today he will ask his pointed question: precision medicine, is that a reality in 2025? And will walk us through the evidence, what comprehensive profiling, liquid biopsies can deliver, how fair data, molecular tumor boards, artificial intelligence can help us to reshape the matching, and why equal access to the testing and medicine is still Europe's key bottleneck. So Professor Gilles Vassal, please join me welcoming on the stage.
Good morning. And thank you very much for the introduction, and thanks to the organizer to ask me to give a keynote talk on precision medicine. And I put this question, a reality in 2025, which is a very provocative question in such a distinguished audience, and really in a country where precision medicine is so important and in the heart of all what is being developed. I would like just all together that we look at where we are in 2025, after more than 20 years of precision medicine development, with a very specific question: is it a reality for the patients? Because data is important, but how can this really help the patient and provide them with a treatment that can help them and being cured? So, first of all, yesterday I looked at PubMed and I found 160,000 articles on precision medicine and 60,000 on precision medicine and cancer. This is really a topic that has been developed over the years with a major program in cancer. I looked then at the definitions, and I found the definition of the National Institute of Health in the US. Precision medicine, emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each patient, not only genes, in contrast to the one-size-fits-all approach for treating disease. And in this, it is not limited to cancer. And then I moved in Europe, and I look at the definition by the European Federation of Pharmaceutical Industry and Associations, which is a more focused definition. A healthcare approach utilizing molecular information, genomic, transcriptomic, proteomic, metabolomic, phenotypic, and health data from patients to generate care insight to prevent and treat human disease, resulting in improved health outcomes. Which is important because this is a vision from the pharmaceutical company, how this can really drive their development for medicine for patients. Again, not limited to cancer. So when it starts from? It starts at the end of 20th century with the first approval of antibody, trastuzumab, to treat women with a HER2/neu 3+ breast cancer, showing that a drug can target a biomarker, an alteration, which is present and can be looked at on the tumor of a patient, which means not all breast cancer patients, but the one with this. Very interestingly, 20 years later, you know that there are no antibody drug conjugate targeting HER2/neu, which are really effective as well in patients with a low HER2/neu expression on the cancer. The second example was not an antibody, but a small molecule in 2000, imatinib mesylate, Glivec for the treatment of BCR-ABL chronic myeloid leukemias. It was again a targeted drug for the presence of a biomarker in the disease, in the cancer. And in 2025, if you look at the indication of this medicine, is more than 10 indications, including Philadelphia positive ALL or KIT positive GIST. So clearly, it showed that the concept was there. Not all patients have the same disease, and if we understand the specificity, we can develop specific medicine to help individual patients. And this was in the 2010s, really the concept that medical oncologists brought forward. Very simple. Have a patient, take a tumor sample, do complete sequencing, all exome, all genome RNA sequencing, and identify alteration. Then you can put drugs against that will help the patient. It was a real important momentum at that time, and there has been a lot of academic program really setting up. Are we able to do this? To do a molecular profiling for a tumor, for a patient having a cancer in advanced stage, and how this would work. And clearly this has been all the first part of precision medicine through academic program, figuring out that yes, it would help all the patients. And the technology since have been absolutely developed in a way that now we are exquisitely able to look at any alteration. The whole genome sequencing, exome RNA sequencing, then the next generation sequencing with panel, and now there are offers with 300 genes in a panel, really covering all the alterations that are relevant for cancer treatment. They look at the comprehensive generation, the CGH, the FISH, the institute, a lot of techniques to look at the biology of a given tumor in a patient. And it moved from tumor specimens to a liquid biopsy. Because clearly, one of the two main hurdles that have been addressed in cancer, looking at alteration in the tumor to drive the treatment for a patient, is A, intratumoral heterogeneity. You take a little piece of the tumor, that it is all what's happening in the tumor. And B, tumor evolution of the treatment. Because clearly tumors evaluate and new alteration makes the tumor resistant to the treatment. So this has been really two important issues that have been worked on in the next years, really, to try to find a way to look at better all the alteration in the tumor and to figure out how to look sequentially in a patient what's happening in her or his tumor. And this is where the liquid biopsy became an important tool. With all the development, now it's feasible to measure in the blood pieces of DNA, proteins, or even malignant cells that are released by the tumor in the circulating blood, which is important because it means that a liquid biopsy recapitulates what is in the tumor, and you don't have only the little piece of biopsy that you did in the tumor, but also you can repeat easily the testing. You don't need to biopsy again and again the tumor to know what's happening, but you can look at the evolution. And this is why the liquid biopsy have been really, over the years, really developed in a way that now it's available also for care. And I just took one example to show you the importance. This is a lung cancer patient with an EGFR mutation that was treated in 2009, received the first chemotherapy, and then the first EGFR inhibitor. And as you see in the middle, is there a laser? Is there a laser? There is no laser. Okay, so in the middle, oh yes, you can see maybe, yes. Relapsing with clearly appearance of a mutation in the EGFR proteins driving resistance to gefitinib. And this really entered to propose, by the presence of this mutation that was not present at the beginning, to shifting from the EGFR inhibitors, gefitinib, to a drug development by AstraZeneca, which was specifically directed for patients with this T790 mutation in their genes. And clearly, as you can see, it was different from the scapula and from the lung. And later on, the tumor of the patient regrew, and you see it's 5 years later, 6 years later, and there were in these samples a wild-type PGFR, wild-type 7090 mutation, but appearance of HER2 amplification. This shows nicely, at that time, where no liquid biopsy was available, that over time, really changes of the tumor can be identified and then generate new treatment to continue to treat the patient. And when we are in 2025 in lung cancer, well, if you look that in 20th century, we had only surgery, radiotherapy, chemotherapy, mainly platinum-based. Today, we have surgery with radiotherapy, and we have quite a number of approved targeted therapies for each of these 2, 4, 6, 8, 10 genes which are altered. And this is an excellent example that all the work done on lung cancer identify all this subgroup of lung cancer patients with specific alteration and the development by the company of targeting agent really for addressing this medicine. And I think this is the best example of precision medicine driving the development of drugs, of medicinal products that can really help this patient. And of course, now we have, in addition, immunotherapy, which really changed the concept of targeting agents, introducing the way to really use the immune system as well to treat the patient with lung cancer. So in about 30 years, the way patients with lung cancer are treated has been significantly changed, introducing precision medicine in the treatment, in the development of medicines. So what are the remaining questions for that? Well, the key question is access. Do all cancer patients have access to a biomarker testing to figure out whether or not there would be one of the relevant approved targeted agents for his or her treatment? And all these treatments, are they available for any patient who would have a biomarker positive tumor? And I think this is a clear, for me, important message. Precision medicine is a reality. The key question is, do patients have access to A, the testing, and B, the drug needed? Because precision medicine without the proper treatment is excellent to generate science, to do AI, and we'll see what it means. But for the patient, access to the medicine, after really saying what would be needed for them, is absolutely essential. And interestingly, this heterogeneity is being addressed now by the joint action from the EU on precision cancer medicine that was launched last September 1st, 2025, coordinated by Cienzano in Belgium. Not Belgique, this is French, Belgium in English. And the goal is to make personalized cancer care more accessible and well understood across Europe. And you see they want to improve access to precision cancer medicine and to generate best practice, which is exactly the topic now. From a patient point of view, all this science and development will provide them with treatment that can cure them where there is no treatment to cure them. So rapidly, what have we done in pediatric oncology? The ITCC network is composed of 68 European institutions in 18 countries developing new drugs in phase 1 and phase 2 trial, including research lab working with a clinician to generate molecular information translational data. And in 2025, sorry, not 4, but 5, ITCC built this strategy. We wanted to figure out what's happening in adults. Is it useful in children? because we need to provide new drug for children who have a disease which is not curable with current treatment. And this strategy was very simple in 3 steps. A, perform a tumor molecular sequencing at relapse for each patient, doing comprehensive sequencing. Through molecular tumor board to analyze this data, match the alteration found to a drug in development in clinical trial in the network. And all this information from molecular, clinical, and results, aggregate this data in a clinical biological database that would target 3,000 patients. We really need to use this with artificial intelligence that will really help better understanding of the disease, and B, finds new therapeutic pathway. This was the strategy in 25. We implemented the strategy. And as you can see, there have been several programs across Europe setting up the capability to biopsy the patient, do the sequencing, and analyze the data and figure out what drug would be there. We are expanding the portfolio of trials, including platform trial, which was a way to say, well, let's have a trial where we can explore several medicine, several drugs, and not a trial, a drug, really to speed up the implementation. And clearly the goal was really to aggregate this database. So what have we done? We have done what we plan to do. There has been oops, sorry, that was, yes, it's blocked. No. The INFORM program in Germany and other countries was developed since 2015, and they entered 1,050 patients, 955 with tumor samples and 926 with successful analysis. And as you can see, 85% has a so-called actionable target, but the ready-to-use target, which is exactly, there is a drug available and we can have access to the drug, was in 42 patients, 8%. And at the end, only 1/3 of the patients received a match therapy regarding to what's happening in the tumor. And as you can see in the Kaplan-Meier curves, the one receiving a ready-to-use drug, NTRK, ALK, BRAF inhibitor, do better than all the other ones. In France, as well in partnership with Spain and Italy, we have been developing the MAPIAX project with the same concept, and 69% of all the 800 patients had an actionable target, 10% ready to use. And we demonstrate that the ctDNA can be used as a surrogate of the tumor biopsy. And 30% had a matched treatment. So we demonstrated that learning what's happening for a patient is helping to provide a drug to the patient, providing that we have access to the drug. And also analyzing molecular sequencing, complete molecular sequencing of tumor sample is not an easy things. And clearly there's a real need of skills sharing, discussing to interpret this huge raw data that can be generating from this patient. And we had one successful story, which was larotrectinib, we knew, which is the NTRK inhibitors for NTRK positive malignancies. Interestingly, the company enrolled patients, even young patients less than 1 year, in the very early clinical trial of this inhibitor. It showed high response rate, and it was the first tumor agnostic approval in adults and in children. And because we had in Europe the precision medicine program I just described, we could identify patients who would be relevant for participating to this trial. Because such a phase 1 study cannot be open in all centers. We need to identify where the patient is, if he is or not available for a given treatment, and then make sure that he has access to the treatment. So showing that yes, it works. To look at the tumor, to look at the alteration, and if you have the relevant drug, there can be some effect for the patient. We aggregated all this data, and at the moment is more than 6,500 whole exome sequencing and RNA sequencing at relapse of tumor quite a large number of data, which is available now in the ITCC PEDCAN portal, and I guess Patrick Cameron will give you more information this day in the data. So clearly, we aggregated this data to look at it, to learn about the disease, to introduce AI, and really to figure out what would be next developed for this patient. But then we said, is it available for all patients? And we surveyed what was happening in the ITCC. And from less than 20% to up 75% of the patients in the network, only the 68 institutions, not all institutions, have access to molecular sequencing. And clearly, the program that I showed, MAPIAX Inform, were a research program funded by EU, a lot by charities and non-for-profit organizations, demonstrating the value. And then nowadays, well, in some countries, such as France, Germany, and the UK, it is introduced in the healthcare insurance system. Other countries have been developed their own solution, and some countries do have access to the commercial solution, because clearly there are quite a number. For example, Roche and Foundation One is clearly one important company providing testing in tumors and in liquid biopsy for patients. So clearly the real goal now is to develop the expertise really on the interpretation of the complete genome sequencing result, because clearly this is the big issue. So just to sample that the situation is still important and negative. Medulloblastoma is a disease of the brain which is specific for children. In the 20th century, there was, in the 20th century, it was one disease. One treatment, radiotherapy, chemotherapy. Since 2000, we know, thanks to all the molecular sequencing, it's not one disease, it's 10 biologically different diseases with different prognosis. But today, there are still not a single new anti-cancer medicine available. So precision medicine helps a lot understanding better the disease, identify potential drug pathway, but the real issue is the development or the access to the medicine, to the medicinal product, really to make this relevant for patients. I am almost finished. So at the moment where we want to go, tumor molecular profiling includes in standard care for all patients the use of liquid biopsy to monitor the evolution. When biopsy is not feasible. Looking at the germline genome sequencing, because clearly when you do a molecular sequencing of the tumor, you sequence the constitutional DNA. And there's a lot of information there, really learning the presence of potential predisposition genes which are even not known for the patient. The key challenge is access to drugs in development and pushing for development of specific medicine to really develop, to address the pediatric malignancies. And then collecting the data. And I mentioned the 6,500 sequencing data of pediatric malignancies, a very rare disease. 6,000 data is absolutely huge. And this can be really help. And this is why the initiative you just described with the memorandum of understanding can really benefit from the existence of this data collected from the patient. So in conclusion, is precision medicine a reality? Of course, it is a reality, but not all patients have access to this. And not all patients have access to the medicinal products that this precision medicine would tell them to get. And of course, it's an important asset for further gene and biological discovery. And I did put this Hallmarks of Cancer by Annan and Weinberg, published in 2011, 2022, really describing all the different pathway altered to explain tumor growth and malignant development of malignant cells. And with all this, there are still many other targets for targeted drug development that we still don't know yet and will be in the future, I hope, identified for the patient. This is what I wanted to share with you this morning. I thank you for your attention.
Okay. So, yeah, I know we are about the finishing time. Nevertheless, are there any questions or comments still for the Professor Vassal? Burning ones? Otherwise, yeah, we can ask later. So, Professor Vassal, we are grateful to you for this keynote speech, and I believe your expertise, but also the passion, were truly motivating and will set the right tone for the remaining of these 2 days. So, thank you so much.
Thank you.
So now, on behalf of the organizers and the Children's University Hospital, I want to really extend my heartfelt thanks to speakers, organizers, and all of the attendees this morning. So thanks for your participation in this session, and we look forward for the valuable discussions during the breaks, also in a coffee break, and the rest of 2 days. So see you after the break. Thank you.